And here on the executive stage, I would like to welcome Gregory Bellairs from the Western Cape Blood Service in Cape Town, moderated by Ben Hoseos of Lean Institute Africa. Let's see, there they are coming up. Hello, Gregory, good morning.
Morning, can you hear me?
Can you hear us? Yes, we can. All right. So I will
It's gone silent.
All right. Hello, everybody. Let's try this again. So good morning from South Africa. Glad to be with you all. Ben Hoseas here from
Got a
Lean
big
Institute.
echo, listen here.
We'll let Greg fix the microphone there momentarily. But just wanted to say thank you to Dr. Gregory Bellairs for joining us. He is the CEO and Medical Director at the Western Cape Blood Service. They were part of our summit in 2024 with a keynote, and likewise this year in 2025 with a site visit. So a fantastic local case study of improvement and all the traditional application and culture. And really excited to hear from Greg, and we'll let him get his microphone sorted out here, but hope everybody's having a good LGC so far. So Greg, you want to do a sound check and just see?
Yeah, Ben, we've got, there's an echo. So after you say something, we hear the same words about 2 seconds afterwards.
Okay, well, I'll stop talking. Can you hear an echo when you speak? Because it's okay if you want to go ahead and kick off.
Okay, I'll check now. Hello? Hello?
That's good. We can hear you.
Great, I've got no echo.
All right, let's go ahead then, Greg. Thank you.
Okay. Brilliant. So, yes, I'd like to thank the organizers for inviting me to present this presentation. And let's get straight into it. So my title is Implementing Continuous Improvement at a Non-Competitive Non-Profit Entity. Why bother? The slides are not advancing. Turn off the headphone sound. I'm getting an echo still. Okay, so my agenda is a simple one. I'm going to tell you a little bit more about Western Cape Blood Service because blood services are not familiar to everyone. And then I'll tell you both why we implemented Lean and how we implemented Lean. And then I'll finish with a few slides on how Lean has helped us. Okay, I'm just going to take my headphones off. Okay, so the first thing is Western Cape Blood Service is an old company. We're 87 years old, in fact, and we're a non-profit company that covers the Western Cape region of South Africa, the area you see highlighted in red on that map. We provide blood products to the population of the Western Cape province, which is about 8 million people. We're the only entity operating in our area, so we are solely responsible for collecting blood from blood donors, and we collect whole blood, platelets, and plasma, 3 different kinds of collections. And then all of those are tested for possible infections. We process those components into further products, and then we distribute blood products to every healthcare facility in the province, both private sector as well as state sector hospitals. And in total, there are around about 140 healthcare facilities in our province that we supply to. So a little bit about blood donation. We can collect blood through 2 main mechanisms. So on the top left image, you will see a motorhome and then another vehicle with a trailer. And that really is the infrastructure that we use to establish mobile blood donation clinics. So what we do there, we send a team of people to, for example, a school or a tertiary education institution or a business or community center. And we set up a blood donation clinic either for a morning or an afternoon or an evening, and then we collect blood. And prior to doing that, what we've done is we've sensitized the people in that area, what we call the blood donation panel, that we will be having a clinic at a given time and at a given place. So that we call a mobile clinic. And then the next day, that same team will go and collect blood somewhere else, and so on and so on. We get about 60% of our blood through mobile clinics, and mobile clinics give us the opportunity to cover every town and every area of the metro, during a cycle, and a cycle usually runs for approximately 2 months. And then we also have a few fixed site blood donation centers, and that's the image on the bottom left that you will see. And these are effectively clinics that we've established usually in shopping malls. And the model there is those are open like every other shop in a shopping mall, and that enables blood donors to donate at their convenience rather than our convenience. So they can go and do their shopping or have their car washed, and while that's happening, they can pop in and donate blood. And we get about 40% of our blood through fixed site donation clinics. Right, the next step in the process is after we've collected blood, all of the blood is tested for 4 different transfusion transmissible infections. So those are infections that, if they're present in the blood that's donated by a blood donor and that blood's given to a patient, the patient can get the infection. So those are HIV 1 and 2, hepatitis B, hepatitis C, and syphilis. And then we also test all the blood for ferritin. Ferritin is a measure of iron stores in the blood donor, and that helps us to keep blood donors safe. And then we test the blood for the blood group type. So as many people will know, there are 4 different main blood types, A, B, AB, and O. And we check the blood donor's type every time they donate. The testing we do is very expensive, but in a country where we have a fairly high prevalence of these infections, it enables us to detect the infections very early and minimize the risk of blood products being contaminated with viruses. And then I think every business has a little bit of unique magic, and ours is the reality that blood is not an entirely homogeneous substance. So on the left-hand image, you will see a blood collection pack with one of the bags filled. And there are 3 other bags attached to the system, all attached by tubing. So that effectively is a closed system of 4 blood bags. And the blood that the donor has just donated is currently in 1 bag. Now, because the red blood is a substance including cells as well as fluid, in which those cells are suspended, if we put donated blood or blood pack into a centrifuge, which is the top middle image, and spin that at several thousand revs per minute for a little while, what happens is the different products sediment out into different layers. So on the right-hand image, you will see that the straw-colored fluid in the top is plasma, and the red cells have settled to the bottom of the bag by centrifugation because they contain hemoglobin, molecule that helps us move oxygen around our bodies. And hemoglobin contains iron, and iron is heavy, and that's why the iron-containing cells sediment to the bottom. And in between those 2 layers, the layer of plasma and red cells is a thin layer, which we call the buffy coat, and that contains white blood cells and platelets. So what we're able to do once the separation has occurred is we're able to drive the plasma off into one of the satellite bags, the red cells into another satellite bag, and the buffy coat with platelets in it into another bag. And from then we can make several different blood products. And the image in the middle on the bottom there just shows, several of the products we make, but effectively there's red cell product lines, plasma product lines, platelet product lines, and each of those may be further subdivided into child size packed or baby size packs. So this is really why one of our mantras when we're promoting blood donation is one donation can save up to 3 lives. And that's because we make generally 3 separate blood products from each blood donation. Yeah, so effectively what the blood service does is we provide a vein-to-vein connection between blood donors and patients in hospital. And the very last step of the process is done by clinicians or doctors, sometimes nurses as well in hospitals, where they order a blood product that the patient needs, and then they will provide the transfusion in the hospital and do that clinical activity. So that's the only part of the vein-to-vein chain that we're not involved in. Right, so why did we implement Lean? The first thing is, as an old entity, and I've been here for over 20 years, we being 87 years old, we're stuck in our ways and fairly complacent about waste and efficiency. And part of that is because we're not competing with anyone, so we don't have to be the cheapest, the best. We're simply the only blood service in our province. We also have a desire to be world class in many other ways. For example, our quality management system and many of our normal processes. We saw it as an opportunity to upskill staff and improve problem solving and teamwork. We saw it as an opportunity to break down silos, which are inevitable in many businesses, and then to reduce waste and improve efficiency, both of which save money. Because our blood product tariffs are directly affected by expenses, any efficiencies we gain that save money can keep tariffs as low as possible. And then finally, we saw it as an opportunity to improve service delivery, which we thought was good, but we knew it could always be improved. And the 2 interfaces we focused on were those involving many stakeholders, i.e. blood donors, of which we have about 75,000 per year, and then the hospital patient and clinician interface, and that translates to about 50,000 people requiring blood in our province every year. So how did we do it? The first thing is we didn't have any internal capability in lean or continuous improvement at that time. So we engaged with a consultant who we'd met at a congress. And the initial phase was him working with the senior people within our service. And then that work being divulged downwards to the workforce in general. And that was all really an initial exposure into what Lean could do. And thereafter, what we did is we had many engagements with our consultant. We appointed an internal resource, our CI or Lean manager, and he's on the senior leadership team. And then we took on a modular approach, and I'll go through a couple of the modules shortly. But for each module, we really sought to have a company champion and roll it out through departments. The company champion would provide support to any department for a given Lean module. And then we also have departmental champions. So people who are more adept for instance, daily management system or quality or resource conservation. And the other thing that was really important was ensuring that we had continuous support, both externally from our consultant, but also internally from our head of continuous improvement. The other part of our approach, as I mentioned, was that we took on a modular approach. So we started this journey in 2017, and we took on quite a few modules in that single year, 4, in fact, daily management system, 5S, problem solving, and VSM. And thereafter, we reduced the number of modules we did each year, basically to give our staff sufficient time for each module to bed down in their areas and then to reach certain levels of maturity. And then you'll see that after 2020, the year of the pandemic, we still managed to do 2 modules in that year, which we're quite proud of. But after that, we didn't do any new modules for quite some time. And the reason was from the modules we'd done up to and including 2020, noting what we do in our business, we felt that we'd probably reaped about 80 to 90% of the benefits of Lean by that stage. But process capabilities recently been plugged in. and we reaching a level of maturity in that. Then the other part of our process was for each module, measuring maturity against certain metrics for each module. So what this chart shows, and let's just choose the left-hand set of bars. So for the daily management system module, when we started, we had a low level of maturity, and through each maturity assessment over time, and you'll see there are many years behind us with that module, we've reached ever increasing levels of maturity. So we're now at a level of 4 point something, and our desired target for this year for that module is in fact 4, so we're in excess of that. And we replicated this across all of the modules that we did. And you'll see as one just tracks very broadly to the right-hand side, the diagram, that with the modules we started later on, we haven't yet reached the highest level of maturity, but all of the maturity assessments, we're on the right track, that with each assessment, we're improving. We definitely had challenges. So the first of those was consultant dependency, which I've already mentioned. So initially we were 100% dependent on our consultant, but now less so. Different departments had different levels of buy-in, skill sets, interpretation. And then, as one would expect in an old company, we're stuck in our ways. So there was some resistance and pushback. There was, in some areas, a we know best and know what we're doing is already good enough attitude. Also, that lean can't be applied here because we're special. And that's probably a byproduct because a lot of the teachings about lean are, for instance, in different kind of manufacturing environments, like Toyota, for example. There were some who felt that it's a waste of time and money, and there were some that felt that it is more work, which is undoubtedly true initially, because it does take more work to get skilled to implement a new module and apply it. At some later point, work should become less work, but there is more work when you do something new. So what did we do? We have a company performance management system, and the 4 pillars supporting that system are on the diagram there. But what we did was simply make continuous improvement a key performance indicator, and we weighted that at 15%. It was progress through the modules was robustly measured through maturity assessments, and that definitely helped get people on board. So how has it helped us? The first is in daily management system. You'll see a picture of a daily huddle there on the left, as well as a DMS board on the right, as well as some data underpinning DMS from a given department. And the detail doesn't matter. The point really is we adopted the usual quality, cost, delivery, morale framework, and we allowed departments different degrees of latitude to deploy or use DMS in the way they felt most comfortable. So some chose to use screens and some chose to use paper. But at the end of the day, all of them measured something for each cluster and drove things towards a target, and always sought continuous improvement. And then 5S was a great help to us. So you'll see different workstation images throughout that slide. Everything's nice and neat and tidy and organized in its place. Before we did this, it was not so. We were pretty neat and tidy, but not quite as consistent. So what the consistency gave us is that if a person worked, for example, in one blood bank at one hospital and moved to another blood bank in another hospital, the workstations would be almost identical across different working environments. And that meant people could be plug and play wherever they worked and didn't have to hunt for stuff and ask people for stuff. Then, even though we thought our service delivery and turnaround times for both blood donation and blood issuing at the blood banks were pretty good, we managed to achieve significant reductions, 42% in terms of turnaround time for blood donors, and between 50 and 75% reductions turnaround time when clinicians come and order blood products from our blood banks in the hospitals. And that was through various things, but the key thing was really looking at the steps in the process, reducing them, speeding up things that had to be done, and really focusing on getting things done quicker. In capacity utilization, again, one doesn't need to look at the detail in this slide, but basically those 5 main clusters are the key steps in blood donation. So donors have to register, have their hemoglobin tested, then be interviewed, and then connected with the blood packs in which they donate, and then we pop the needle in their arm. So by looking at each step in the process, how long they took, how many people were involved, we were able to develop a tool that would help us predict how many people we needed at a blood donation clinic, depending on how many people we expected to visit to donate blood, and really started optimizing steps in the process as well as number of people involved to eliminate waste. And then this is a slide just showing the reduction in overtime paid in our blood banks over 3 consecutive years. And that went down markedly from about 750 hours in 2021 to 120 in 22 to 30 hours in 2023. And this was largely achieved through deploying people cleverly, reducing steps in work, and the direct output. And this is a true financial indicator, was the reduced overtime we had to pay as people's salaries. And then this chart shows staffing reductions across multiple years in 3 separate areas. The blue bars are blood banks, in the orange bars are blood donor division, the gray bars are finance division. So despite the amount of work we do each year going up by 2 or 3% per annum, just because the population of this province goes up by that amount, across 3 key areas, due to working more efficiently, we've been able to reduce headcount. And as everyone knows, headcount requires salaries, and people are generally the most expensive part of an entity's expenses. So this has resulted in considerable savings on our expenses. And then we looked at walking waste in a blood bank, for example, made some changes, shifted some equipment around, changed the sequence of steps in a process, and reduced walking waste by several percent. And the time available for actual meaningful work improved from 75% to 94%. In other words, less time spent walking and wasted work, and more time actually on the laboratory bench doing stuff that generates output. And then I'm near the end now, but yeah, in terms of resource conservation, we've done a huge installation of solar on our roofs at our headquarters, as well as another site. South Africa has been plagued by what we call load shedding, which are effectively power outages due to failures in capacity on the national grid. And on that chart, you will see that, through the months of this year, our dependency on power from the grid, that's the blue bars, has reduced. And then both kilowatts from photovoltaic energy, as well as the RAN quantum, which is the orange and gray bars respectively, have started increasing towards the right-hand side. And that's been as we've progressively unlocked our power generation from solar. So we're saving money and reducing our dependency on the grid. And the end point of this in the next few weeks is that with our battery storage system, we will be independent of the grid for as long as 4 to 6 hours per day. So we've bought ourselves independence, but we are always able to supplement our electricity requirements with those from solar. And then, yeah, as many entities would also have done, we've looked for opportunities to use less paper, use less energy, and to recycle. These are all part of our resource conservation. Not only is it good for the planet and it's a source of pride for our staff, but many of these also save money and translate to the bottom line. So in summary, lean is a significant investment for any company. It certainly does require extra work initially, but should result in improved efficiencies, less waste, and savings. I believe it can be applied in any entity. It's not ring-fenced to production environments or for-profit environments. Resistance to change decreases once benefits start being realized. And this blood service has realized many benefits. So for us, in the answer to my question on my title slide is it has been worth the bother or effort, not just for the organization, but also for all of our key stakeholders, which are blood donors, doctors in hospitals, patients requiring our blood, funders who pay for our blood products, suppliers who supply what we need to do what we need to do, and for our staff. So on that note, I thank you.